You've tuned in to Stranger Than Fiction News, broadcasting live from the dark side of the planet. This is a very special report. We figured out why these hospitals are empty, why all of the drive-in testing is empty. No information about it whatsoever out there. The reason is they're not fucking testing. They're still not fucking testing. And we've got the proof of that, ladies and gentlemen. And people that have been tested, they're waiting, a week, 2 weeks still, no results. Massive backlog. They still don't have it right. The testing doesn't work. There's a huge problem there at the beginning of the process. And it gets worse, ladies and gentlemen. We've got a lot of bombshell news here. Let's just play this here for you. If we can, hold on, yeah. The video guy's on vacation as usual.
Coronavirus testing last month, but some have been overwhelmed with the demand, and patients and health officials are now frustrated over just how long the wait period is for some of those test results to come back. NBC4 reporter Ted Hart.
So this is just a preliminary report. We're going to come back, but this was dated April 2nd. This wasn't like, March 7th or March 2nd, or this is still going on right now. They're having major issues with the testing. No testing is happening, ladies and gentlemen. And here's a real disturbing video. The little people that do come in, this is like Elmhurst Hospital in New York City. Listen to this.
Patients
Hold on.
into this corner. The patients into this corner. That they've locked me into the corner, and it's impossible for doctors and nurses to access my bed, which means that I'm not getting any medical care. I haven't gotten my vitals taken in 5 hours, and I haven't been given any medicine even longer than that. I've complained that they have to change my position so that they can provide me medical care just like everybody else.
So this is coming from Bronx Net TV videographer Stephen DeCastro. He's been locked inside the Elmhurst Hospital in a corner. Nobody's talking to him. Nobody's giving them meds. They're just trying to kill people as quickly as they can, get rid of them. They're trying to let people die at home as quickly as they can and get rid of them. And they're not testing anyone. And that's why the hospitals are empty pretty much. Not only that, but I mean, they've basically stopped all elective surgeries, no visitors, no witnesses. They're even arresting people now for showing up at the hospital trying to film what's going on. They're trying to murder everybody. And they're not testing anybody at all. Like, we've searched for anything with like a testing site. Everything's empty. They're not testing. That's why the hospitals aren't getting a lot of traffic. They're not testing anyone. If there's no tests, there's no positive tests, there's no health care. That's the solution to the problem. The numbers stay kind of down. And it makes us think, like, given that there's absolutely no proof of any testing going on right now, this is like day one, and then after that it just stopped. They're probably still got a backlog of all the people that came and tested day one, where it opened up to the public. And then after that, it basically became by appointment only. And let's see if we can find, everything's stalling out here a little bit. We're broadcasting live. What the fuck is this dumb shit? Let's see. I'm not sure if this is the video that we wanted. Of course, the Matrix is just making it difficult. This is what we were looking for. Pre-book testing only. So you're not getting booked for an appointment. You're not getting a test. You're not getting results to that test. And therefore, nobody's going to the hospitals. And that's how they make it seem like there's there's nothing going on. They still haven't resolved the issues with the test, period. That's the problem. And so there's no testing going on. We got some testing at the naval ship. This is the only thing that we could find about testing on ScrewTube or Twitter. You just type in testing, drive-through testing, any kind of testing, no tests, waiting for results, and it's just, crickets. And the only thing that we actually got was like this test from the USS Roosevelt, and they fired the captain of that ship after he cried for help, saying everybody's infected. So, who's lining up for that test? Oh, that looks sexy. So that's the problem right now as we see it. There's just no test. There's hardly any footage of people, dealing with patients, and that's got everybody like, oh, where is everybody? And it's a valid question. We're like thinking to ourselves, hey man, where is everybody? And then we're finding out there's still no testing. There's no tests. ladies and gentlemen. And we could actually spend all day on this information. We got a lot of information to cover. But, you know, they did testing day 1 where they had it open it up to the public, and then they shut everything down. And, you know, I've been looking for tests in Fargo testing protocols, and there's just, go search for yourself. Try to take a test. Instead of just filming hospitals, try and take a test. Try and take a test. Call somebody. Get a test done. You know, just say you've got the symptoms. You want to show up for a test. When can you get a test? Wait to see how long it takes to get the results. You'll never get the results. You'll probably never get the test. They got a problem with the test. They got a huge problem with the test. Look at these shills with their pyramids, ladies and gentlemen. Pre-book testing only. So they've made, you know, they found the catch-22. Well, if we can't test anybody, still they're on that same thing. Even though they're promising, like, if you want a test, you can get a test, you can't get a test. There's no test there for you. This girl here, you know, she's sick and she's staying at home, and listen to her thing. If we can, hold on. I'm gonna have to get back to it. Don't know if she's a dubious one or not. She looks dubious. They all look dubious.
Need to be hospitalized. By leaving your house to go and to get a test, you are infecting others. Excuse me.
So there's a lot of people out there with like the perma-flu. They've had the flu for like a month or 2 months, and they're just sitting at home. They're not getting a test. And the people that want a test can't get a test. And so little by little, people are just going to be dying off. You saw the orders, do not resuscitate. And here's like a real interesting clip from Fox News where they're talking about the new Abbott test that's supposed to be like, you know, 15 minutes, you know, a little toaster oven test. And that means like they could probably do like maybe 10 tests a day per machine. You know, by the time they get the sample into the machine.
Test.
Even if they were like jam packing it 24/7, you know, they can only do 4 tests an hour per machine. You know, one right after the other. 4 tests an hour. And, you know, if they run it an 8-hour day, that's 32 tests per machine. How many machines do you think they're going to have per clinic? 32 tests. Right? So
test at a time. It's a great test, but it's one test at a time. It's different.
It's one test at a time. This is the new little toaster oven test. And it's 15 minutes per test. They're doing it so slow so that they can't test anybody and nobody can go to the hospital. Ladies and gentlemen, your treatment plan is now available. If you jump through the hoops and ladders, they'll send you to do a drive-in test. If you can get there, if you can get that far. And by the time they actually get back to you, you know, with your treatment plan, good luck. So now the question is, don't just film the hospital. Film the test. Where's the test at? And that's where the real bottleneck is. And I think that's probably the most important thing to talk about right now. This is why the hospitals are empty. They're not testing anybody. They're not accepting anyone. They're telling people to stay home. And if you do get called in for a test, it's a quick drive-by test, and you'll never get the results. And they're just trying to buy time, see how many people actually survive until the summer, and then wave 1 is complete. But we, at this stage, I mean, it just calls into question, you know, where are these numbers coming from, ladies and gentlemen, like that they report every day. We don't see anybody lining up to get testing. You know, you got people running around to the hospitals looking for lines of people to get tested or something, and you're just not seeing anything. They're not calling anyone in to get tested, period. That's why, you know, it's not that people don't want to get tested. It's not that there wouldn't be a huge fucking line of people trying to get tested. They've made it so you've got to get an appointment, and they're just telling people, yeah, don't get a test. So if they were telling people to get a test, you would see people getting tested. But all of the videos that you see at testing centers, it's empty. They're not calling people in to get tested, period. Even we're getting reports of like nurses and doctors, they're not getting tested. All right. So everybody mask up. It's airborne, you know. So there's a lot of questions right now. Is there a virus? Is there not a virus? Is it real? Is it not real? I think all options should be on the table. But based on what we've seen, you know, from numerous places, there is a virus. Numerous videos, there is a virus. You know, you look at the submissions in the gene banks, like on NextStrain. We didn't pull that up, but we might might just do that here in real time. You look at next strain that actually has like analysis of all the different strains, puts it on a map, on a timeline, etc., etc. And you can see all of the entries. You know, it's probably going to take its time here, but you can see all of the entries from the gene banks. So all of these different nodes are submissions to the gene bank, and they've got, you know, the sequence. This went through a lab. It's got, you know, a serial number. Look at all of these different sequences. So what are these people picking up if there's no virus? Is the question. There's probably a virus, but now what they've decided to do is not test. They've still, and that's been their policy since day one. Do not fucking test the sheeple. No treatments, mass casualty, mass, you know, murder. That's the problem that we have right now. And there's, you know, every time that they come on and they're like, oh yeah, you know, the numbers have gone up to this. Where's the proof? Where are these tests? When were these tests taken? You know, we're just not getting enough accountability here. When were these tests taken that they're reporting right now? What's the backlog? Where are people getting tested now? Show us proof of that. You know, they say they're testing 100,000 people a day. It doesn't look like they're testing 100,000 people a day anywhere. Where is this testing happening exactly? What hospitals? In what method? What mode of, you know, of submission? We're not seeing the testing. They're not testing people. They're just fabricating fucking numbers. Now, what we know here, supposedly, according to the numbers, and we got to bring, oh, hold on. Yeah, here we go. We know from various tracking websites that there's somewhere around 6,000 critical cases in America right now. And that about 2,000, 3,000 are in New York. So that means, you know, throughout the rest of the country, there's maybe another 2,000 or 3,000 people on ICUs. You know, divide that up by all the hospitals. And you've probably seen the maps, and, you know, your area probably isn't really that affected. If they've got 1 or 2 people in ICU in your hospital, that's about it. Otherwise, the hospital is a fucking ghost town. But, you know, what's surprising here is that there isn't more people getting tested, that there isn't a sign of people getting tested. You would think, you know, you've seen all the videos of people lining up at Costco getting toilet paper. You would think that there would be, you know, lines like that somewhere, you know, of people getting tested by appointment, that you would see, you know, something, you would see some action, but there's no action at the hospitals. And so, you know, that makes you wonder what's going on. And it's not that there aren't sick people, is that they're not testing. They're not testing anyone. They're not bringing anyone for testing. They're not bringing anyone for treatment. The people that are brought in for treatment are basically crammed into a room, a little room somewhere, left to die. And let's listen again to a patient right now in Elmhurst, a videographer who's, you know, probably, you know, snuck in his phone and posted this. And listen to this dire situation, ladies and gentlemen, if we can. Let's play this again.
Patients into this corner, that they've locked me into the corner, and it's impossible for doctors and nurses to access my bed, which means that I'm not getting any medical care. I haven't gotten my vitals taken in 5 hours, and I haven't been given any medicine even longer than that. I've complained that they have to change my position so that they can provide me medical care just like everybody else.
And this is actually worse than the field hospitals. Look how close they are to one another. They're like inches apart when they should be at least like 20 feet apart, right? They're just crammed together like sardines, no medicine. And you can imagine the community virus load in this room must be off the fucking charts, meaning that every breath they take, I mean, is just full of virus, right? And so there's no way to get better in a situation like this. This is why they're saying 80% of people that, you know, that end up in this situation don't make it out. The ones that recover are the people that, you know, never made it, never went to the hospital in the first place. Those are the ones that recover for the most part. But hearing this from somebody in Elmhurst, which is like one of the, you know, ground zero hospitals in New York City, you know, seeing how people are crammed in. I mean, you definitely see people here. They're hidden in just like a room in the whole fucking hospital. They're all crammed in together, right, inches apart, and just being left to die. And that's what's going on in the nursing homes. That's what's going on across America. They've told people to stay home and fucking die. They're not testing you. They're out to kill you. And that's what we're seeing behind these empty hospitals and empty testing centers. You know, so it takes a while to think about, okay, what's going on? Well, you know, you could jump to the conclusion and say there's no virus. You know, we'll get into that. We posted quite a few things right now. Let's see if we can get into the regular mode here, ladies and gentlemen. Not sure if we can, but we'll try our best. Yeah, okay, we'll try and get into regular mode. But we posted a lot of videos where you see like the hospitals are like ghost towns. There's nobody there. And it is pretty perplexing. Here's a guy that tried to film a hospital, 3 months in jail. So they don't want you talking about it. Event 201. Again, this is just kind of like an abbreviated version of the broadcast. We'll do a full broadcast later on today, but we really wanted to get this information out ASAP. And all of the information is posted on our website, stfnreport.com. But here, Miami Beach opens its first COVID mobile testing site. This is an hour ago from, you know, like the Miami News and CBS Miami, right? So they're just erecting these things now, but still, the testing won't be going on. And for the things that are already up, there's no testing going on. No testing. So they've got like these empty shells. There's a problem with the testing. Huge problem with the testing. Still. So again, all of the information here. Update on COVID Illinois testing. They say there's 10,000 tests a day. Where are these tests? Just in Illinois. Where is this happening? We're not seeing anybody go, you know, we're not seeing 10,000 people. Now here's somebody that went into a hospital. This wasn't in America, but those are the last, you know, minutes of the disease. People are struggling to breathe. You know, there's the test. You can't imagine why people aren't lining up for that thing. But again, you know, here's a testing clinic in Australia, you know, and empty. But this is what we're seeing around the world. They're just not testing people. What's this? Las Vegas, Nevada, Henderson, and you know, for the most part, there just isn't anything going on. They're not calling people in for testing. And here's, you know, another one.
Tons.
You know, so, you know, there's nothing, there's no traffic in or out. It's straight to the fucking mortuary. It's not to the hospital, it's straight to the mortuary. That's the deal. They're burning the bodies. There's no telling how many people are dropping dead right now. But all the testing clinics, all the testing facilities, empty. Why? Because they're not testing. They're not inviting people to test. And we're getting this from doctors and nurses too. They can't even get tested. There's a problem with the tests. That's why everything's so fucking empty. That's why it's so empty. There's always an answer to why we're seeing what we're seeing. And the biggest clue is, you know, the testing facilities themselves, they're empty. There's no videos on the internet right now of a testing facility actually in action. You don't see one fucking testing facility on the internet in action anywhere. Period. In America anyways. I mean, South Korea, they might be doing it. In Iceland, they might be doing it. But in the USA, they are testing zero. So it makes you wonder about their fucking numbers. They're lying to you right now. They're like, oh yeah, we tested 100,000 people today. Bullshit. They didn't test anybody today. They're just throwing out numbers, you know, based on, you know, other data, you know, like what their samples tell them, you know, should be, or whatever. But there's no activity, hardly, you know, except every once in a while, you know, you see some ambulances go by. But they're not testing anyone. And if they're not testing anyone, then there's nobody coming in. And the people that do get stuck in there, they're killing them. You know, we've got, you know, here's Bozeman, Montana, March 31st, just a couple days ago. And doesn't look like a whole lot of activity over here. Looks like people are on their lunch break, you know, just taking off. But, you know, over and over, here's another testing facility, San Jose, California. No lines of traffic, no people coming in, no activities, no action, you know. And, you know, this is pretty much across the board. We're not meant to see what they're hiding. here. They're hiding something. It's, you know, it's obviously really weird. There's Elmhurst Hospital. So we just saw a video from the inside of Elmhurst Hospital. You know, we could play that again. But on the outside, doesn't look like a whole lot of activity. And they're certainly not testing like on day one. There's like 1 day of testing and then they stopped. You saw 1 day where there were lines of people trying to get tested and then they just stopped it. No more tests, period. See all these testing facilities? They're the crematorium. You saw the fucking crematorium right behind it. Hold on, let's get back to it. Hold on, let's get back to it. Okay, you can see the smokestack right here. You can see the crematorium, all right? But there's no testing. So, look at this. Here's the troops on the front lines from the hospital, empty beds, right? They're not testing. They're just like, stay home and fucking die. That's what the message should really stay. It's not just stay home. It's not just a stay at home order. It's stay home and fucking die order. That's what they're telling people. Stay home and fucking die. Now, this is a field hospital in Spain. You can see they're testing people. They're bringing people into the hospitals, to, you know, and their field hospitals are full. You look at our field hospitals, it's completely fucking empty. All right? All of them. There's, you know, there's nothing. You know, these are empty.
And, there's a lot of work.
Empty, still empty. You know, you look at the New York Central Park Field Hospital, go try to find video of people in there. Empty. Why? They're not testing. Here, this is the Nightingale Hospital. Empty. That's in the UK. Here's Chicago. Empty. They're not testing. Empty. This is Los Angeles. Empty. All right. This field hospital, they did a nice little commercial of one field hospital out there in Italy where you saw people, but otherwise empty. And here in the UK, you know, it's like COVID is jailed 3 months for wandering around the local hospital. So they're trying to spin it like, oh, you know, nobody's sick. That's not the problem. They're not testing anybody. That's the fucking problem. They're not testing anybody. Period. Oh, and Trump's company seeks financial help. They let this shit in. They fucked the whole country, and now they want, you know, they want to get bailed out. You know what I mean? Captain of the U.S. Navy carrier has been fired. Ladies and gentlemen, European leaders warn this could break up the EU. Travel data of passengers arriving in the United States from China during the critical period of December, January, and February, when the disease took hold in that country, shows a stunning 759,000 people entered the U.S. from China alone. Republican Senator Loeffner sold $20 million in stock. She sold her stock in one thing, and then she bought like a bunch of like coronavirus protection stock. You know, and she was telling you everything was fine. You don't need a mask. U.S. death toll tops 1,000 per day, so they say. But you know, we need to see the bodies. We need to see the records, and we need witnesses to those records. Trust no one, and we need to see, you know, videos of them testing people. That's the problem. They're not testing anyone. Go find a video of a testing site in action. You know, film your testing site. They're not testing anyone ever. Go try to get an appointment for a test. Good fucking luck. You won't get one. And if you do, it'll be like, you know, 30 days before you get the result. So that's reports right now. There's people that have been waiting since like, you know, beginning of March for their results. So, you know, what results are coming in? You know, whose tests, you know, where are these 100,000 tests a day? Where, you know, where is that happening? None of their tests fucking work. And, you know, that's just one angle of the story. Of course, you know, the order still stands. They will not resuscitate anyone that's died of a COVID heart attack. They will not resuscitate anyone, period. And all the people right now that, you know, are supposed to have like cancer treatments or all that shit, they're going to fucking die. All the people that are supposed to get, you know, whatever, dialysis or whatever, they're all going to fucking die. Right? So, you know, this is liquidation. That's what's going on. They're going to liquidate all the old, all the weak, you know, total Nietzsche kind of shit right now. And we'll have to leave it there for this broadcast. We'll be back later. But we hope that update was impressive. It should be. You know, at first it might be a little shocking. All right, but check out this video for yourselves. This was uploaded yesterday from NBC Columbus. They're in Ohio, one of the most, you know, heavily impacted states, supposedly. Oh, they're not testing, and they can't They got a huge backlog of tests. And so, where are the numbers coming from? Ladies and gentlemen, where's the actual testing happening? They say they've done 20,000 tests today in Ohio or something. Where are those tests? Where did that happen? Let's see the video of that. Let's get specifics here, because as far as we can tell, they're not testing. And, here in this report, they're like, oh, I've been waiting forever for my results, But you're seeing so few reports like this, like there's trouble with the testing. They come out every day, oh, we've done all these tests, we're ramping it up, we've done a wonderful job. Bullshit, they're not testing. That's the problem. There's still huge problems with their testing, and we need to know every little thing about testing right now. Until the next time, ladies and gentlemen, if you're listening to this, you are the reason.